Let's take you back to that story in Cape Town where people who are homeless and do not have IDs will now be able to get vaccinated against COVID-19. This comes after NGOs in the sector raised concern about this vulnerable group possibly missing out on the jab due to their lack of documentation. Western Cape Minister of Health Nomafrench Mbombo is due to visit the NPO Hope Exchange in the city where vaccinations are due to get underway. And we're joined now by Vanessa Poonah. Vanessa, have the vaccinations begun?
Yes, good morning to you. The vaccinations have indeed begun here at the Hope Exchange, NPO here in Cape Town. At the moment, I can tell you I've already spoken to two people who've received their jab this morning. It is a Johnson & Johnson jab. And to explain a bit more about what has been taking place in terms of getting people who are living on the streets, homeless people, to be vaccinated, is Reverend Annie Kirk. She is a board director of Hope Exchange. Reverend, good morning to you. The issue of vaccinating the homeless has been something that has been concerning for NGOs like yourselves for quite a while. I think about a month ago or so we were here, and at the time you highlighted these issues to the MEC for Health, Dr. Nomafrench Mbombo, who's due to arrive here just now. What has happened since? Because I see there's a hive of activity this morning. A number of people have been taking up these vaccines, of course, as the Western Cape is now in its in the peak of the third wave, with about 40,000 active cases at this point in time. What has happened to bring us to the point where homeless people, even those without IDs, are being registered this morning?
Thank you so much. Welcome. So, after we were visited by the Minister, we then met with members of her team. And as NGOs who are working with homeless people and also NGOs run by homeless people, we raised the key issues. Firstly, that many people, maybe up to 50%, don't have an ID, may not know their ID number. And so we sat with the team, we made suggestions including can we take someone's name, their date of birth, can we use a hospital reference number or hospital file number, for example. And so collaboratively we came up with the workaround to this issue of not having an ID. And so today that's exactly what will happen. People's names and names and date of birth will be taken, forms will be filled in, and they will be then added post today to the system to make sure that the fact that they've been vaccinated is recorded.
We also understand that the type of vaccine being used is the Johnson & Johnson. It is the one jab vaccination. And of course, I suppose the thought process behind that is due to the fact that, with homeless people living on the street, it may be difficult then for a follow-up visit. Is that the case? Is that why the Johnson & Johnson vaccines have been selected for this group or this cohort of people to be vaccinated?
Definitely. We wanted to ensure that people could get access to the vaccine today and there wouldn't need to be a subsequent follow-up because people move around or they may not be aware of the time frame that's, and the return date and that sort of thing. So it's much better just to do a one dose.
At this point, I understand that this is one of the centres. Of course, we know that the vaccination of homeless, over 60, for example, those with IDs, have been taking place. There have been NGOs assisting with that regard. In terms of those without IDs, is this the only centre at this point? Is it something that will be rolled out beyond the metro to the rest of the province?
Yes, that's what we hope. So with working with the Department of Health, we said this is a pilot today. This is the first phase of what we hope will be several. We've already identified other sites and locations and the NGOs that could assist with facilitating those, and we've given those to the Department of Health. And there's a lot of enthusiasm and support from NGOs and people working amongst homeless people to ensure that everybody gets access. Also, we've had phone calls from other provinces because the Western Cape is the first province to begin this process. And so in KZN and Gauteng and other provinces, they're very keen to see how they can also work with the learnings from Western Cape to ensure that it happens in other provinces. We're talking about thousands of people, and so we want to make sure that everybody has access. And as you said, the cases now in the third wave are up to 40,000. There's been about 1.3 million people vaccinated so far, and we recognise that homeless people are a substantial constituency that need to be taken care of.
Reverend, some of the issues and some of the concerns initially is that homeless people, for example, would not have had as much access to information. So I understand that there probably was quite a bit of an awareness campaign firstly, and then also, as I understand, with those that are vulnerable, there may be trust issues when it comes to figures in authority. How did yourselves, along with the health department, overcome? Because when I look behind me, quite a number of people, and it's early yet, are already here. Some have already been vaccinated, others are waiting their turn. What exactly took place in order to combat those challenges when it comes to gaining the trust of people to get them to the point where they made the decision to be vaccinated?
Yeah, we really must commend organisations like the Strandfontein Homeless Action Committee and other NGOs in the sector, because they engaged street-based people, asked them what their concerns were. What were the challenges that would inhibit them from gaining access, but also what concerns they had. Some of the concerns were, for example, people have chronic health issues and not always access to the medication they need, or sometimes it's taken when law enforcement remove people. And so people had questions about that. Was the vaccine safe? Also, those who are substance users had real concerns. If they have the vaccine, will actually it undermine their health in any way? Would there be repercussions? So we were able to take those questions to the Department of Health. They were able to give us responses which we could give to those on the streets and who are engaging with the services. And I think it's been a really powerful collaboration actually in making sure that key information is the questions asked, and then we hear what the concerns are, and then we're able to respond.
Thank you so much for speaking to me, Reverend Annie Kirk, of course, a board director of this establishment, the Hope Exchange, where this morning I can tell you that the queue is moving very quickly. Already we've spoken to a few people who've taken their jab this morning, saying that they are grateful for the opportunity. Some also telling us that they did have initial concerns, but after a communication they now feel satisfied that they've done the right thing for themselves and also for those around them.
Vanessa, thank you so much for that update.